Hi, my name is Dr. Pecoraro. I'm a chiropractor in Scotch Plains, New Jersey. I've been a chiropractor since approximately 1975, and I went to Columbia Institute of Chiropractic, which is now New York Chiropractic College. And this video is for chiropractors only. It's about a cervical adjustment for patients who either can't lie down or are afraid to lie down for some reason, and their head can't be turned in any way. And it's something that I've developed over the years. I'm sure you have developed things yourself, but I thought I'd bring it to your attention in case it might help you or your patients. But anyway, what you would do with this type of patient is you would have them sit in front of a firm surface such as a desk, and have them put their arms in this position. And what they're going to be doing is sitting in front of the desk or whatever it is and putting their forehead right on this area of their hand, just like this. They're usually bent forward a little bit. Now in that position you can perform an adjustment without them turning their head, and they haven't laid down, and almost anyone will feel comfortable in this position, even if they're afraid to lie down or afraid to turn their heads. Anyway, in this position you can work from either side of the patient and use a lighter force than you normally would use, but you'll be using basically this area of your hand on either the spinous process in a posterior to anterior direction, or on the lamina on the right or left, again in a posterior to anterior direction. So the contact would be similar to this. It's a lighter force. I'd say the force is probably on the order of, that I use, is probably on the order of maybe 3 pounds of pressure. And it's a type of thrust, but it's rather light. And you can palpate before and after to see if it made any difference, and also ask the patient if they feel any difference, if you're interested in that. So I hope you found this helpful, and you can try it and see what you think, and I hope it helps you and your patients. Thank you.